Molly. Today's video is everything you want to know about the prostate cancer test. Hey there, YouTube. Today's vlog is going to be about the prostate cancer test. What do you guys know about the prostate cancer test? Is there one? Well, I'm going to start off with the short and sweet answer about this test that can detect prostate cancer. The answer is there isn't one. There's no prostate cancer test. And why? And I also want to let you guys know about the importance of the PSA test. Why is it important? Why do it? And along with the common reason most guys that I talk to tell me they don't want to get their prostate checked because of the finger test. So the bottom line, to start off with, there's no prostate cancer test. What I want to begin with is just some facts that a lot of men don't know about. Prostate cancer will affect 1 in 7 men. 1 in 7 men will be diagnosed with prostate cancer. And prostate cancer, this is super important, guys. Prostate cancer is the #2 killer of men in the United States. Lung cancer is #1. I talk to a lot of men, and a lot of you guys, because of our talks and just the information that you're getting, are going out and getting PSA tests, which is really, really important. That's the first line of defense, along with the digital rectal exam, to find out if there's a potential for prostate cancer. Anyways, let's start out with the basics. My story begins like this. So once upon a time in May 2017, I had a prostate infection. Went and got tested to see if I had an infection. Had an infection. And so it's something important to realize is if you have prostatitis or a prostate infection, doesn't necessarily have anything to do with prostate cancer. But what they do as a common course of diagnosing this is that you get a prostate infection test. So I went ahead and did that. My PSA levels were up. What is the PSA test? The PSA, well, let's start out with the basics. What is a prostate? The prostate, and you know, the thing about this channel is none of what I say is necessarily in medical terms, because I, along with the majority of men that I talk to, don't even realize what the prostate does, why it's there, why it's in such an inconvenient place in the first place, and anything to do with the prostate seems to be a mystery to most men, including myself, until I got diagnosed. So the prostate, in the most non-medical terms, it's a little walnut-shaped doohickey that is in between, I want to say, the bladder, the urethra, and your rectum. And it's kind of placed right in there. And it's in a very not convenient place. Doesn't seem quite logical to me. But I'm not a doctor. And so what happens as you get older, the prostate tends to enlarge with age. That's just the nature of the prostate, and these are things that cause it to press because of the enlargement causes it to press on the bladder, and so you end up getting up in the middle of the night and going to the bathroom. This all plays into this. Sometimes the PSA number, and the PSA is the prostate specific antigen, and what that is it's something that's in medical terms that can go up and down. That number can go up and down. When it's elevated, you could have the reasons that the PSA numbers go up is because for several reasons. One, you could have a prostate infection. Another thing is that you may have had sex the night before. You could have been sitting for too long. Your prostate's enlarged, and it's a condition that happens, and it could cause your PSA numbers to go up. Or you could have prostate cancer. But so when you do a PSA test, you go in, and most men do it about once a year, starting after age 50. Your doctor will say, let's do a PSA test. And what that is just a check mark on your blood work paperwork. When you go get the blood test, they'll check that box off, and they'll check your PSA level. What they'll generally do is with the PSA level is they'll see if you're close to the number 4. Anything under 4 for your PSA level, you're probably doing pretty good. They're not going to get overly excited about that. If your PSA level starts rising over the course of 2-3 PSA tests, and they'll do these maybe a month apart. But let me explain something. I want to talk for a minute about the digital rectal exam and why it plays in concert with the PSA test. So on the one hand, you have the PSA test, which is your blood work that they do, and they do this test. The digital rectal exam. This is where most men have a little bit of a hang up. But if you go get your physical every year, once a year you get a physical after age 50, the doctor's probably going to do the finger test. What is that? It's a little bit annoying the first time you have it. So after age 50, the doctor says he wants to put his finger up your butt. Why is he doing that? Why is it important? Because the butthole apparently seems to be in really close proximity to where the prostate is. So the doctor goes in and he feels around where the prostate is. Why is that important? Because your prostate, they can tell two things. One, they can tell the relative size of the prostate gland and see if it's enlarged. It's a good thing, because that could be the reason for some of the problems with the peeing at night and things like that. All right. The second reason is if you have tumors in the prostate, your prostate is not going to be smooth. The doctor will feel maybe some bumps or some protruding outside of tumors from the prostate, and it could be bumpy. So if your prostate is a little bumpy, that could show that there's some tumors in there. Anyways, it should be nice and smooth. Interesting thing about the PSA test and the prostate. The majority of men that I talk to, when I first got diagnosed, the guys that I speak to at work and friends of mine, I'd stand there in front of them and I'd talk about the prostate cancer, the importance of the PSA test, everything that I learned in non-doctor terms, and they would sit there with their eyes wide open. Every man that I spoke to didn't have any clue what the prostate. I don't think they knew they had a prostate. They had no clue what it does. What does it do? The prostate is there because, and again, I'm not a doctor, but the prostate it works in conjunction with the little sperms, and it somehow it's magic that the prostate, when a man gets all excited and it wants to shoot that little sperm out, that prostate helps it, and rockets explode, and that's what the prostate does. That's what it's there for. So, aside from that, I see no other use for the prostate. But, yeah, so that's what it's there for. So, men, now you know. It helps shoot the little sperms out. That's what it's good for. And so the thing is that I talked to a lot of men about it, and they didn't know what the prostate was. I don't think most men know they have one. I don't know that I knew I had one until I was 50, and the doctor said, "Hey, let's do a prostate exam." He put his finger up my butt, and then I found out, I guess there's a prostate there, and you have to put your finger up my rear in order to find out whatever it is you're finding out. But the doctors over the years just said, "Yeah, feels good." I said, I'm thinking to myself, it doesn't feel good to me, but if it feels good to you and you say it does, then I'm good to go. I don't care if you know. I don't care if you know that you have a prostate or not. What I care about is that if you don't get checked on a yearly basis. Why? Because prostate cancer, by and large, has no symptoms. Let me say that again. Prostate cancer, by and large, has no symptoms unless it gets out of the prostate. If the cancer gets outside and starts affecting your other organs, then you have symptoms. You don't want to get to the point where you have symptoms of prostate cancer. There is no prostate cancer test, right? So what do? Once a year, go see your doctor, have your physical. At the physical, ensure that your doctor make sure the PSA level is checked. Let the doctor put his finger up your butt. If you catch cancer early enough, it's curable. The fact that you refuse to go see the doctor to get the PSA test done once a year and to have the digital rectal exam could result in you dying because you just didn't take the time, or you couldn't. Prostate cancer is no joke. Take it from me. I'll be doing a video on sitting at the doctor's office, finding out you have prostate cancer. The good news is, if you do get diagnosed with prostate cancer because you were proactive and did all the things that I have suggested, you can catch it early. You can be in the 99% cure rate and hang out with your loved ones, your kids, your significant other, your grandkids. Go out and do all the things that you want to do because you beat cancer. Why? Because you listened to Ken, the unprofessional, non-medical guy who told you, go get the PSA test, get the digital rectal exam, and find out if there's a problem. Because the majority of people I talk to, the majority of men that I talk to, don't know squat about the prostate, what it does, where it's at, or why they have to get a PSA test. Now, everybody who watches this video has no excuse. You know what it takes, right? So let's get it done. And I'll see you on the next video.